Romney's running mate, Paul Ryan, proposes using a voucher program to pay for Medicare premiums. Medicare won't go away immediately. It will be offered as one of a list of companies that can provide seniors benefits. But insurance companies wouldn't have to provide exactly the same coverage as Medicare has in the past. To compete for seniors' business, they can start changing the benefits that are provided, thus attracting healthier people and discouraging those with more complex health issues. Into the future, as insurance plan premiums increase, the amount the government has to pay for premiums actually decreases. Therefore, the burden of healthcare costs, both premiums and cost of care when you've hit insurance limits, goes up. Unfortunately, this happens whether we have Democrats or Republicans in office. How would you structure the Medicare plan, and how would taxpayers pay for it?
Well, I'm still in favor of the single-payer system. I think that the voucher system is poorly thought out, certainly not in the best interest of the vast majority of our population here. I myself am eligible for and receive Medicare. I've been a little bit disappointed with it, but I'm glad it's there. I paid into it, so a lot of people like to call it an entitlement, but I've sort of bought and paid for that particular benefit through my lifetime and expect to have it until I die. And I'm not too happy with politicians that are kind of messing around with that system.
They call it an entitlement rather than an earned benefit.
Yeah, a lot of people look at it that way, and I believe it's an earned benefit. And I think the people who paid into it deserve it, and they deserve it to be run efficiently and to the benefit of the vast majority of people who are utilizing it.
Harry? The voucher program.
It's been estimated that anywhere from 1/3 to 1/2 of the cost of our medical system is spent on terminally ill patients in the last 6 months of their lives, where they are literally tortured to death with all the procedures so that the doctors and the hospitals can make money. This is called fee for service, and that's what's part of Obamacare and Romney care. Fee for service means the doctors and hospitals are on commission. They have a financial incentive to make money with every aspirin they give you, with every tissue they give you, and they are running up these bills and performing thousands of unnecessary and brutal procedures on patients that really can't fend for themselves. If we don't get this profit motive out of our healthcare system and get with what Santa's talking about here, a single-payer system that doesn't have that profit motive, we're never going to solve this problem.
Okay, JL.
Harry hit on some positive points there, which are actually negatives, because they're awful.
They are.
I mean, meaning the extra tests and the no less than cruelty on people that don't need the tests. However, the major cost with medical is the reoccurring payments on the investments that have long since been paid for. Vouchers, that's not a bad idea, but instead of turning in a voucher for a, what would amount to a $300 CAT scan, we're not turning in a voucher for a $30,000 CAT scan. So the voucher system is not a bad idea as long as we get the original investments out of the way of the medical system.
Santa, I see you shaking your head. You have 30 seconds to rebut.
I think the voucher system is a very poor idea. We've seen it on school levels. We've seen it before in certain medical situations, and I don't like it. I think it just drives up prices and isn't really beneficial to the end consumer, the patient.
Harry?
And if I could add, it does nothing to solve the fraud problem in Medicare, which is in the billions of dollars. You've got so much money flowing in the system, and it's so easy to steal. And it's so hard to figure it out, except in every other major industrialized country, they seem not to have that problem because they have, as Sam was talking about, a very simple, straightforward, single-payer system. That's what the rest of the world has, and has a much higher healthcare standard of care than we do the average person in this country.
Okay, JL, do you have a few? You have 30 seconds to talk about vouchers.
Yeah, well, a voucher, meaning if they're going to exist, we need to lower the costs for the medical care. And the only way to do that is to kill the recurring payments on things that have already been paid for. And as far as the rest of the world's great healthcare system, we should tell that to the people as they come into America for the proper care, because that's where they find it, and that's where they're finding it today.